Ever wondered if what you've heard about anesthesia is true or just a myth? Well, let's dive into it. Anesthesia, a vital part of many medical procedures, is often shrouded in mystery and misunderstanding. It's a complex field, and as with anything complicated, myths and misconceptions tend to spring up. Today, we're going to be your mythbusters, shining a light on some of the most common fallacies surrounding this medical marvel. So, stay tuned as we debunk some of these common myths about anesthesia. Myth number 1. Anesthesia always causes memory loss. Let's bust this myth wide open. Sure, it's not uncommon to experience some temporary memory loss after anesthesia. You might forget the ride home from the hospital or a conversation you had in the recovery room. But here's the thing, this effect is fleeting. As the anesthesia wears off, your memory will bounce back to normal. The risk of long-term memory loss is extremely low. It's usually tied to other health factors like age, pre-existing cognitive issues, or certain types of surgery, so it's important to have those in-depth chats with your anesthesiologist. So no, anesthesia doesn't always cause memory loss. Myth number 2, you can wake up during surgery. Now this is a fear that has been dramatized in many a movie scene, but let's separate the fiction from the facts. The reality is that the chances of waking up during surgery are extremely rare. Anesthetists are like vigilant guardians, constantly monitoring your vitals and adjusting your anesthesia to ensure optimal comfort and safety. Even on the rare occasion where a patient may become semi-conscious, they usually don't feel any pain due to the analgesics in the anesthesia. It's more akin to a hazy, dreamlike state than a full-blown wake-up call. So let's put this myth to bed. The fear of waking up during surgery is largely unfounded. Myth number 3. All anesthesia is the same. This is quite far from the truth. Anesthesia is a versatile tool in the medical field with various types tailored to different needs. There's local anesthesia, used to numb a small specific area for minor procedures. Then there's regional anesthesia, which numbs a larger part of the body, like when you're giving birth and they use an epidural. And of course, there's general anesthesia, which makes you completely unconscious for major surgeries. The choice of anesthesia depends on several factors, including the nature of the surgery, the patient's overall health, and the surgeon's professional judgment. So, it's a myth that all anesthesia is the same. There you have it, some common anesthesia myths busted. It's crucial to grasp that anesthesia doesn't always cause memory loss, you won't wake up during surgery, and all anesthesia isn't the same. Remember, when it comes to anesthesia, it's better to be informed than to believe in myths.